Welcome back to the Crooked Spine Show. Have you ever had neck pain or even upper back and shoulder pain where it won't go away? This talk helps you understand how do we exercise, meaning stretching and strengthening, to make that pain go away and stay away and improving your posture at the same time. We walked through about 3 shoulder exercises, we walked through about 3 stretches, we talked about walking and sitting too, how it can affect your overall neck, also to how neck treatment can cause an actual stroke and the risk of that. So listen to this podcast, understand there's things we can do to help combat and make our body looser and stronger and help our body overall relax. Most important, to relax and de-stress so our neck muscles stay relaxed, our body stays relaxed, we can handle more stress over time. All right? Listen to the podcast, watch the videos. If you need to go to the actual highlights of this podcast, do in the show notes. If not, listen in, and I'll talk to you afterwards. Today's talk is about neck pain. How do we fix neck pain? What can associate with neck pain? Headaches, arm pain, arm numbness, arm weakness, anything like that. Even shoulder pain back here. Okay? Even eye pressure also, some will get that. Nausea, migraines, combination of those. Some people feel like they're being choked. Those neck muscles come from the back, they come from the front. It's called the SEM muscle. Control that area. What do I usually talk about if you've been here before at any of my talks? What's the first thing I usually worry about when someone has neck pain? What's the first thing we normally do? Anybody?
Your back.
Back? What else do we talk about normally? What's the first thing I usually check on people?
Heart attack. Stroke.
Sometimes you would think stroke, even especially with men, would be left arm, left chest. Women, right arm, right chest, right? Okay? Once that's been ruled out a cardiology issue or medical issue, the first thing we usually talk about is how's your overall posture. Okay? Posture is something is a chronic pain. Exactly. Most people just like, I feel great, right? Okay? The biggest thing is how do we look at posture as an issue to where is something a problem to where it can't get better on its own. If I see someone in chronic pain for means it's been 4 or 5 days, sometimes weeks or months, where it's not getting better with medications, with icing, with stretching, with even physical therapy, or even exercise. Okay, give me 1 second. I need to plug in one more thing and we'll be on complete sound here. Now I have all the lights on, yes. Okay, so before we talked about, I think the last one was back pain, whatever it was too. Same thing, always posture first. Talk about posture. Sitting posture is what people mostly fault because we sit here initially, right? And also go from here to here to here to here. Okay? And if you're going, I don't know why my neck hurts, why my shoulders hurt, why my arm goes numb or weak, why do I have headaches to my forehead behind my eye? Okay, so again, it's from here to here to here. Side view, same thing. And the side, where I'm going from here, shoulders back, ears, seam of my arm or my shoulder for 1, 2, my shirt, head back, shoulders back here, where my back looks somewhat straight, correct? Right? Okay? Now we go from here to here to here to here, leaning forward where our head goes in front of our body. Our shoulders, so we don't fall forward, they'll naturally come up and they'll roll forward, so your shoulders roll forward and your back starts to hunch. Okay, so when someone has this, I go, do you think you have a posture problem? They go, no, I feel great. You know, because they've been this way for probably anywhere from 3 to 4 months, sometimes years. And they felt great there. So they didn't have a problem. There was no condition they felt as being an issue. So what we do is go, okay, if that feels good to you, let's try something. Okay, what I have them do is go against the wall here in my office or wherever I am on the road, Route 66 or something, I don't know, stop people on the road. So I go here, put your heels against the wall, hips, shoulders, and head. How does that feel to you? There you go, it feels like I'm leaning backwards. Okay, because realize, makes sense, right? If I'm naturally here hunching forward, I'm going to go from here, this is my mind straight. I'm going from here to here, I go, I'm leaning backwards. I'm going too far back. Because you've had to transition, you're relatively changing your body's position. Okay? So my job, if that doesn't feel right, you come up front. I save your seat right in front for you. Or over here, it's up to you, wherever you want to sit. Just don't fall asleep this time. Don't fall asleep this time. It makes me look bad if you fall asleep. Actually, scoot over a little bit so you can see behind you. Just scoot over a little bit. Scoot this way. Scoot that way. There we go. There we go. Perfect. I don't want to block people's view. Okay. So if I'm here and I go back and I feel like what you'll usually say is I feel this muscle's tight there. I feel my head's going too far back. I feel like my lower back is being pushed too far forward. Okay, does that make sense? Exactly, right? If my back is naturally, when I'm punching forward, my lower back has naturally become straight, and change that transition in my body, now it feels from here to here, feels like I'm going forward because I felt good before. Okay, so look for all these signs and go, how do I change that? Okay, we talk about neck pain. Once you go from posture, what's going on? I go, where does it hurt for neck pain? Because neck is a combination thing. People think it's different things. I should tell people, neck is right here, okay, in the back of your head. The problem is that muscle in the back of the head there, right here so I can see myself, here, that neck muscle extends out to the shoulder, down your back, down even further, if I can stretch myself out, and also runs to the front of the neck, to your sternum, to your clavicle. Okay, even past your shoulder in the front too. All these muscles control your head from falling one way or the other. Realize the neck muscles itself, those are postural muscles. Okay, what does that mean? They move unconditionally of your thought. So even though I'm here and I go, hey, what's going on over there? I do this. I'm not telling this muscle to relax, this muscle to stretch. It does it on its own. Problems we have neck pain or neck injury, such as a car accident, and we start feeling everything. Okay? Those are always moving to hold your head up to handle the load of your overall head. Any questions about that? So someone says, I'm going to work my neck muscles today, which is an odd thing to say, right? Okay? They're telling me they're working these muscles here. If you work those muscles, that's when you're making your neck stiff and where it can't move on its own. It needs a natural flow, natural motion, not only for nerve flow from your brain to your body, but also blood flow too. It needs both. So you want to keep these muscles relaxed. You want to make these muscles, if possible, weaker or stronger based on your position. If my neck is naturally back here, okay, where my head has good posture sitting, at that point these muscles here should be tight and strong. And those muscles extend, again, the upper trap muscle from the point of your shoulder to about C2, C3, the base of your head, your occiput back here, and also these muscles back here. The shoulder muscles in the back of your shoulder, posterior delt, should be nice and strong and relaxed back here too. This happens when your neck curve, your neck position, is relaxed coming backwards. Okay, does that make sense? Your structure dictates where your muscles are going to go. My neck is naturally forward this way, my structure, my neck spine, at that point if it's forward, the muscles are going to have to pull harder and going to have to tighten up the neck, and then you're going to cause problems in neuropathy down the arms, more neck pain overall, and a bad cycle of stuff. My job is to make sure your neck muscles relax along with your neck spine so it naturally sits like it should, sitting backwards behind your body, natural curve coming backwards, so your head sits back over your shoulders, so it's nice and balanced. The more the head comes forward, the more these muscles have to tighten up in the front of the neck. It's called the SCM muscles to hold your head from wanting to fall even more forward. What happens when they become tighter? Become more stiff. Become more stiff, less motion. Less motion. What happens when you have less motion in a joint? You think? Muscle becomes stronger or weaker? Yes. I like the 99% said weaker. Someone said stronger. I think it was that guy over there. Okay. But you want to keep it weak. You want to keep them strong by having normal motion. You have 7 joints in your neck, almost 8 if you count the occiput. Those joints move freely. They move freely back here when your head's back where it should be. When it comes forward, the bones want to lock, losing the motion and causing weak muscles. Weak muscles in the neck correlate with tight shoulder and painful muscles down here, because now these muscles here, a leverage system has to hold the head back now. It's working too hard. Okay? The first thing I want people to do when they understand that is make these muscles looser on the actual shoulder, the upper trap muscle itself. Okay? That connects from your shoulder, point of your shoulder to the base of your skull. Okay? You want to do that by bringing, in this sense, because right now I'm facing you guys on my left-hand side, bring my right hand behind my left ear, Left ear. Right hand, right, left ear. Okay, and then from there, turn your head to your left shoulder. And then letting the weight of your arm pull your head toward your body. Okay, anyone feel that? Okay, so want the weight of your arm to let your head come toward your body, so it comes down toward your body. Get the muscles to stretch. It's a rotation with natural flexion coming forward. Any questions about that?
This is harder than a new position for sex.
I'm going to cut that out later. Sorry about that. Okay, so here, switch sides too. Other side. Okay, let's do this. Left hand now behind your right ear. Let your head naturally turn to your right shoulder. Now let the weight of your arm again pull down toward your body. That should feel tight, maybe sore, but not painful. Okay, when you stretch, stretching should feel tight and sore, but not painful. If it's painful, then it makes the muscle guard tight and makes your body worse. You're almost causing more problems in your body by causing a painful stretch. Okay, when I tell my patients hold between 30 seconds to a minute, that's enough time, 30 seconds to a minute, make ligaments in your spine stretch along with the muscle, so everything's being relaxed and stretched, and over time more motion. Okay, any questions about that? Going back, we want more motion. That means things stay strong and don't become weak. Okay? After I've done that one to make these muscles looser, what happens is now we want the head over time. Someone says they're sore, but they're not in pain anymore. Okay, it's sore, but it's tight, but not sharp pain. Okay, people come in. I had a lady come in last week. She was about a 9 out of 10. Okay, 9, 10 neck pain, arm pain down her left arm. Okay, from a car accident, even headaches too. And once you got down to where now she feels maybe a 4 or 5, but it feels stiff and tight. Now we want to do more neck stretching itself. We want that neck to fall backwards again, behind your body, and cause a natural stretch. Okay, I'm going to pull out my yoga mat here and show you my neck pillow stretch that I have in my video series. What I do is put a lot of exercises on YouTube. And what I'll do is, if you want my email to get this video later, I'm gonna put the link to our video or posture exercise on that we have on YouTube too. Okay, so here I have people do on my tables. So this is not my tables, my mats, obviously. Okay, as I have them do is take a bath towel, or I have a half roll in my office. Put this right here. And what I do is at home is have them wrap up a towel, and put that at the base of your shoulders here, so that when your head falls back over that. So just to demonstrate on my beach towel today, should be thicker, but that's all I had. Here, I'm going to lie down and put that on my shoulders. So here, my head starts to fall back behind my body to make my overall head relax over that bath towel. By relaxing versus having to flex the muscle, allows the ligaments to stretch even more, get the head to fall back more. Okay, so what people do is come down first, see how that feels. Sometimes I'll support the back of their head so they sometimes can't go back that far. That feels good, coming all the way down. They go from here. Okay, now, what you do is have your hands just start for 30 seconds with just your arms over across your body at your sides. Then, bring those arms overhead. Okay, let them relax over here. Why do you think that's important? 30 seconds to a minute. It makes the body now stretch the mid-back to go from just here to here, so the whole upper body is being stretched backwards too. Allows the whole neck and upper back to become easier to stretch over time. People say that sometimes they'll feel a stretch at the base, at their brow line, or at their lower ribs, because their whole body is doing this. Everything's tightened up in that area. By doing this stretch, allows the whole body to come backwards, those muscles to stretch, ligament stretch, more motion, more relaxed muscle, better posture, better position. Okay?
Wait, while you're there, I'm trying to learn how to sleep on my back and on a reasonably firm mattress with pillows under my knees, and that back neck thing is the hardest thing.
We talked about it a couple of times, and it kind of is a controversy too. Just take a side note, we're sleeping is, if you're going to use a roll or something rolled up for your
Yeah.
neck to support you. You want to make sure your neck can handle that time. Realize I just did this, have my patient do it too, for maybe 30 seconds to a minute. Not very long. If you're going to sleep this way, you don't have a good neck posture or structure ready, you're going to cause neck problems.
Oh, yeah.
So you don't want to do that.
I'm good at that.
I want my job, I guess my middle line is if you're going to use a pillow to sleep with on your back, keep your head in the middle of the pillow, so your neck has some support, but your head's supported too. Okay? Make sense, Tom?
How are we supposed to sleep? Because we sleep on our sides.
If you sleep you can sleep any way you want to sleep. The problem is sleep on your side, which is fine. Again, side note here is I recommend, because most people sleep on their side, right?
Yes.
They sleep like this, or like this, so now their body curls forward. They go fetal. Okay, when they go fetal, the problem is the back stays stretched out, it doesn't relax. It does your neck and shoulders too. I recommend is putting your top leg behind you, so it allows your body to stay relaxed here instead of going fetal. Your body will stay straighter by having that weight of the upper leg behind the knee of the other leg. So now the gravity keeps your body from wanting to curl forward. That's my quick tip on that. On the back is just coming back here. Support either medium weight pillow in the middle of the pillow with your head. The legs up or down, whatever's come for you. If you have a bad back problem, the problem is the pillow feels good because it makes your back feel straight, like a hunched over position, versus being curved naturally like it should be here. Stomach is...
You want to feel a little support on your neck.
Exactly. That's where you want the weight the most. You probably want 40% here on your shoulders and 60% on your head. Want that variation. And I was going to say a second ago, if my body's like this naturally, I'm hunching forward, and I try to sleep like this feels good to me. My body's hunching forward. My knees up. If I bring my legs down, the problem is now my back has to curve more. Now it feels like it's being stretched out beyond what it's used to. Okay? So I want to make sure if someone tells me this doesn't feel good to them, I'll support things initially, I'll support their knees. We're talking about I want them to feel better here. I'll give them things for their back to actually that back to stretch itself out.
Well, I also use a little pillow smaller than my back and
Yeah.
a pillow under my knees.
It's not
The final question
Yes.
is my wife got a bed mattress that can be tipped up a little.
Yeah, that's fine.
I like that.
Yeah. Good for you.
It's,
But the thing is, with those are great because they conform to your body. The problem is if you start conforming to your body's like this all the time, then you're just adjusting your environment, which they scientifically call your environment, to your posture. It's poor posture, you're going to have a poor posture to maintain it.
I just try to get real comfortable so I can fall asleep properly.
Yeah, that's the thing is you want to be able to comfortable. You want to be comfortable where it's comfortable all the time. So good question, good transition. Is if you're comfortable all the time but you have pain, my job is to make you uncomfortable by these stretches, so your body gets better, so you don't have pain. That make sense? Sometimes exercising will be uncomfortable to make your body in the long run a better standard. Again, a better posture to make your body want to stay there so the pain goes away, then you can get stronger. Okay, that's the plan. Once you start getting stronger, then your body can tolerate more stress, maybe driving, sitting, whatever it might be, and not feel worn out, fatigued. Okay, the problem is if these muscles and joints stay here all the time, now there's no motion again, muscles weaker, less oxygen. Where does that affect? Your brain. So it's realized it's not just position and motion, it's how your whole body's being affected. When you feel that, and you feel that tightness and soreness and hunched over posture, then you don't sleep very well. Okay? Then you have less energy when you do sleep. Throughout the day, your energy becomes less and less and less. What we do is sometimes we'll adjust our environment, like you'd said, and get a different bed or a couch, whatever it is, to make your body feel better. I want to feel comfortable, so you get stronger and better here. Again, better posture. So we stay here, and we stay here to make this feel better for a longer period of time. And this is the next thing too. Our posture sitting has to change a little bit. This may seem good or bad to you, if you can see this or not. Is here, I have people do, some people ask, how do you normally sit? They go like this. Okay? Natural posture here, natural here, right? Feet forward. Even in some companies, they'll give you a stool for your feet underneath your desk, so your feet can go there, and even a lower, for example, armrest too, so you're here. Even head support back here too. Problem is, again, you're conforming to what your body feels good versus what's good for your body. I want that lower back more curved, upper back straighter, and the head coming back. What happens is when your legs are forward, your knees sometimes are level with your hips, or sometimes even go higher than your hips, like in a car. What happens when you get that, when the knees are higher than the hips, now your back has to stay hunched to feel okay. There's not enough room for your hips to clear, so now your back stays hunched going forward. What people do is put their legs either underneath their chair or on the side of their chair, so now their knees can actually go below their hips. Even moving on the first third of the chair too allows them to drop the knees even more, so now the back can actually clear to have more of a natural, relaxed curve. When you do that, does that feel like you're going to fall forward? Yes. So what your body does is the counterbalance, gets these muscles in your lower back to fire to hold you up here. Okay? You want to feel like you're leaning back because you're counterbalancing your weight going forward. Use your own body's natural center of gravity to support you, to benefit you. Not make your body more relaxed, but to make your body stronger. It's hard in the car to understand. You're at a desk all day, whatever you're doing, can you stay back here with your knees below your hips so your body stays up here instead of where you're going, you're hunching forward? Any questions about that? Yes, ma'am. Yes, ma'am. Ma'am, not sir, ma'am.
I've got a quick question. It's a
Yes.
little bit unrelated. I've been told that when we walk, we should look up, look at the horizon, and that keeps our posture up. Is that true? Walking anywhere, should we always be looking up?
Good.
But then we don't see what we're going to follow.
Yeah, that's called the liability. That's called the liability risk.
Bring our
Okay.
posture up.
So,
looking up.
and here's how, and going from sitting to a standing posture too. Here's my quick tip for that. I want your head up here, yes, but I want it looking down over your nose, here, looking this way, instead of at the horizon. Okay, that makes sense?
Then you
If you have good periphery, at that point you should be able to look about 45 degrees down or up. At that point, with your head up looking down over your nose, allows you to actually see what's in front of you.
Jack, be careful. You're walking on the sidewalks here and up. You've got to really glance down.
That's nothing wrong with that. Nothing wrong with that. Okay, and also too, walking posture too. Same thing like sitting. You want the weight behind you here. So what people do is after they've gone on the wall and check their posture first here, to walk and move, to exercise, I want them to, like especially on Euclid, upper parts of Euclid, I see people when I come to work every day like this. Okay, they're walking on Euclid like this. Problem is you're reinforcing this posture. I want them to get back here, right against the wall. Against what I have to do is when they're standing, is put their weight on their heels. So again, like sitting, it makes them force to stand up straight. By doing this, and we talked a second ago too, by leaning back, these muscles, your rectus spine muscles, lower back, the rectus spinae, what they'll do is lock up and tighten up. They'll pull you by causing the pinch up here when you lean back more. It takes time to adjust your posture wherever you are. The weight on your heels allows you to feel that better position over time, so these don't get sore because they're strong. But walking this way allows your back muscles to get stronger, so you stay here, and then from here, when you move this way, help out your brain to see this as your normal posture, change your brain's position of space. Then, when you sit, allows you to stay back there the whole time. See that magic trick? That was quick. Okay? But you have to give yourself time to adjust your brain's posture to a better standard posture, to better sitting posture. It takes 2 to 3 weeks. It's not easy. It feels uncomfortable and weird. I want you to feel comfortable and weird. That's the plan. My patients. Okay. Another thing too is your feet. When you stand, when you're out here like it's like, okay, I'm try this out. When you stand, are your feet straight or are they coming out? Everyone's different. If your feet are straight, your hips stay open. They stay open to let your back come back further naturally. If your feet are coming out, your toes are pointing outwards, your SI joints, your hips will close off, so it keeps you locked going forward. Okay, everyone's different. So when you get home or when you're out of here, see if you're duck foot or straight feet.
What about pigeon toe?
That's not as common. That's more of a TFL band issue too. That's more of a tight muscle. Okay, that may be hereditary also. Most people have this because they say they're physical labor, they walk a lot too. Because the problem is with your legs, we think we're all balanced, right? Okay, we're not. We're off by maybe 3 or 4 degrees. But our quad muscle here is you have one quad muscle. You have your magnus, medialis inside muscle, lateralis outside muscle. That's as much anatomy as I know. Remember, okay? The outside muscle is all supported by a TFL band that supports you along the piriformis and G medius, so you don't pop your hip out when you walk. The problem with that is now you have a separate muscle here. So when you walk a lot, your knee will naturally turn out because that extra muscle is pulling your leg out. Okay, does that make sense? Okay, so you have to focus on, if my knee is naturally already coming out, focus on getting that foot forward, make your body go heel to toe, pushing off your toe with that knee coming over the toes. That's a different talk I do too, but you want to make sure when you're walking, that knee goes over the toes, doesn't come out this way. A lot of people do that, but pigeon toe is an issue too, but with the toes coming out, you want to make sure those muscles are going to be a little bit evenly balanced. If someone has that issue, what people do, it's called a knee exercise. I have them do knee extensions where I have them point their toe out and push their leg up. By doing that, it's making the inside knee work harder, okay, against resistance. So I've used either a band like this, here. Against resistance is the key. Is where I have them here, have them do is push here with their toes coming out. Want a little more support there. That's my foot here too. It's going to work or not this one. Okay, yeah, here it is. Where I come out this way against resistance, or like this, because by doing this, it makes the inside muscle work hard. It's called the VMO muscle, vastus medialis obliquus. Here, make that muscle work harder. Make that knee over time get strong. Because sometimes people walk a lot, they have knee pain. As you get their foot position, because if the position is wrong or off, makes the inside weaker. Getting this inside stronger helps balance out that TFL bend on the side. All right. Any questions about that?
Well, I was watching very carefully here because I noticed that, you're supposed to walk, I think, 2 feet straight.
Mm-hmm.
Okay.
Yes.
I watched my wife, and she'll start off this way and swing it around.
Yeah.
And she swings it around.
Yeah.
Is that okay? Or
You can do whatever you want to do. It's a free country.
it does different things on your hip,
The thing is, when you do something once, not a big deal. But over time, now your joints and your muscles will adapt to that. So if a joint's meant to be here, right? You start popping your leg out, you start whipping your leg around. Now the joint starts wearing out this way, here. It's not meant for that.
But you see a lot of people
Yeah.
with knock knees, especially women, because of the high heels that they wear. It's just
That's not stereotype, people. Some men wear high heels too.
well, anyhow.
The same.
But
Okay.
I wanted to get back to sleeping.
Well, the goal is make sure that your knees coming over the toes the whole time, and keep your body back to it. All right.
But back to the previous thing, I want to get back to bed.
Nap
I
time.
can get myself flipped fairly, so all of the little pain is evenly distributed over every muscle on my back, neck, and shoulder.
Yes.
So now I want to know, are there any analgesics I can take that will help if I can't get to sleep?
Some people take melatonin for one too.
That
Melatonin, and they take that as a way to get their body to go to more of a deep delta sleep. The biggest thing with sleep that I see is your body's under stress because of pain, for example, or tightness. It just stays in a stress state mentally and hormonally, so now your body stays there. The goal is to move more, in my sense, move more so you get that body into a more relaxed state based on changing your hormone levels, more workout, more exercise. And everybody can sleep better, get a deeper sleep so you wake up better with more energy.
I was
Good.
hoping you were going to say good stiff drink.
If you want to, it's up to you. You might you're maybe underage, I'm not sure. Okay. So here's the next one. Talked about these being a little bit too tight and sometimes weak, making your body want to hunch forward, correct? Correct? Just want to make sure we're awake. Okay. How do we get this stronger and this stronger to pull your body back here? Okay, I want the posterior delt stronger, the upper traps more relaxed. So your rhomboids here, the middle of the back, again, here, middle of the back, make that pull in more and down so your body stays here instead of coming forward again. Okay, this is called my 3 shoulder exercise. So number 1 is going to be here against the door, elbows locked in, and coming out with your water bottles first. I use water bottles. They're I think they're Sam's Club. Any water bottle will work. Okay, out, hold, come back in. Out, hold, come back in. This is posterior or external rotation for this posterior muscle right there. Okay, we're focusing on that right now. Out, hold, and come back in. So now what we're going to do is focus on getting these shoulders to not only come from here, but also drop backwards also. Reverse that rotation backwards. We're going to come here, second part. Elbows against the wall, horizontal with your shoulder. Here. Now come up, hold, and come back down. Okay? Up, hold, rotate those water balls up above your head. Come back down, keep your 90-degree angle with your elbow and your shoulder and body. Okay, up, hold, and relax. Last one.
If it hurts, what's wrong?
If it hurts, you don't have any motion, you're fine. You're good, you're good. Yes, ma'am.
For how long do you do this?
Good, good. Thank you for reminding me. I have people start out with 5 here, hold, down, and 5 for each one. Then we go to about 10. Okay? This is more motion and some strength in your body to think where my shoulder should be versus where it is right now. Okay, someone's hitting the light switch over there. I think it's him. All right. Last one here. I'm going to have someone demonstrate out a second too. Is now I want to go from off the wall here. Keep your hips on the wall. Move our feet forward. And here. All day long. All day long. Okay. Here is now I want to let our body come forward about 15-20 degrees. When we do this, now we have our shoulders up here, our water balls below us, we have water balls above us here as a reverse fly hold and relax. Okay, now we're going to work with this exercise here, this last part. Up, hold, and relax. Now get all of this back here to pinch together. So here, hold, pinch, and relax. So now the body can stay back here instead of being forward this way. Okay? So I'll have you demonstrate. Come on up. Yes. I give prizes afterwards too.
Can you guess what I'm envious of her
Yes.
about?
Right there, feet against the wall. Okay, hips and shoulders good. Elbows locked in. Let's go straight out. You can keep those elbows in the whole time. So here, if your hand can't go all the way backwards, that's fine. Elbow second allows just focusing it back there. Good, there we go. Does that feel okay? You feel it back here? More of a stretch here too?
Yeah.
Perfect. Get that
straighter out.
That's actually good right there. That's good right there. What happens is that, like you had mentioned too, the anterior delt gets tighter, posterior delt gets weaker, so that whole area has to stretch and pull. Good, like you're doing. Now elbows up here. There we go. And come straight back. How's that feel? You feel it back there again too? Oh yeah, she goes, oh yeah. Whew. It's tough. Tough. Good. Okay? Now let's do this. Watch me first. Bring my feet forward. Hips on the wall. I'm going to come back about 10 degrees. Here, I'm come over. Bring the water bottles up. Bring them up in front of you a little bit. There we go. Good. Bring them down. Come on up. And pinch right there. There we go. Feel that? Good. Good. Head up too. There we go. Good. And smile. Perfect. Gotta have fun, right? Gotta have fun. Well, good. Thank you very much. Thank you. Go back to seat. Out here. It's coming.
Your shoulders against the wall.
So you want to start with water bottles. The reason I have to start gets more motion. Okay, you can go to canned plates if you want to, but it's not about strength. First of all, it's about position, right? I want your body to feel back here. Then we can load some weight when your body's ready. Make it stay there. We have to start, and some people call it a slide or a bridge. We start with motion first, position first, right? Position first, and from there motion, and from there strength. Okay, so the next one is going to be here. We lock the elbows, it's called the wall fly. Lock the elbows again with my I think Costco or Sam's water bottles. Here, now what we're going to do is from here, we're going to come straight out and hold it, but I'm focusing for this one, hold on this lower portion here, to make now that area really pinch together, and then relax. Okay, I'm going to hold it for about 5 seconds. 1, 2, 3, 4, 5. Relax. When you do this, you're going to feel, in a separate exercise, you're going to feel your whole body kind of lean backwards more. You come here, lean back, hold. 1, 2, 3, 4, 5, and relax. I'm working the lower rhomboids too. You can latissimus dorsi also, these side muscles here, to make that whole area pull your body forward. Pull your body backwards to make your lower body come forward. Right? Any questions about that? Good? All right. Yes?
How many times a day can you do?
Good. Good. She's my repetition person. Is 5 start with 5, and then move up to 10. Once your 10 feels good, then go to a heavier weight.
I know, but how many times a day can you do that?
I would do it probably twice a day to start. Okay?
Because my pain is really bad.
So what I would do is have someone do this first exercise first, before stretching, and then end with the ice pack. I like ice better than heat. Ice brings inflammation down that you would have when the muscle becomes painful, becomes swollen. You want to bring that swelling and inflammation down with the ice pack. All right? Good question, good question. Next one is how do we, now we feel this is getting better, right? Okay, I feel pretty good here. How do I make this muscle, now that it's looser, stronger? What do you think? Break dancing? Like that maybe? I wouldn't. I'd hurt myself probably. Pull a hip.
I think this is a good idea.
Don't give all my secrets away. Jeez. Next one I do is called a reverse fly. Okay? Same water bottles again, 3 times in a row. Okay? I'm going to just put them on my side, sitting down. I'm going to also lean forward just a little bit like we did a second ago here because I want to work these back muscles back here to make them, now that they're here, stronger. Okay? Come to my sides with the water bottles. Come straight up. And when I say straight up, little elbow bent here. Where now, I say I'm pinching back here. And now I'm working these whole muscles, medial delt, and also upper traps. Make the whole area come up, hold, 5 seconds, and relax. Hold, 5 seconds, and relax, either standing. I recommend sitting, because make just the upper body kind of focus on that for 1, 2. Up, hold, then relax. Making sure all of this pinches back here. All right, any questions about that? Again, 5 seconds, or 5 times, holding for 5 seconds to start, and working up to 10.
The nice thing is you can do all this watching TV when the commercials are on.
At 20 minutes an hour. That's why I don't watch TV. Too much work.
While you're watching commercials on
So
TV.
that's the reverse slide. Next going to be like as I'm talking before too, is the shrugs. When you do shrugs, what happens is, again, same water bottle. Again, here, you want to be against the wall flat. Again, we want to promote this posture here, move this better position, keep our body flat against the wall. Okay? Want to bring those shoulders straight up, hold, and relax. Up, hold, relax. Again, want to do about 5 seconds. 1 hippopotamus. Yeah. 2, too long. 3, 4, 5, and relax. All right? Again, you want all of this stronger. Why do you want it stronger? So you can keep your head back here. You can sit for longer periods of time, and at that point, stay here instead of becoming more weak and tight. All right? Any questions at all?
Or you can do it watching a scary show, too.
You can. You can. I like the comic relief. Any questions at all? Anything? All right. What I'm going to do, like I said before, if you want to fill out this form, if you don't get emails already, I can email you the form for 1, 2. Just to walk through again, you always worry about posture first, and then stretching, and then strengthening. So you want to make sure when you walk out of here, you walk out on your heels, your body's up here, and walking heel to toe, so your body stays up looking with your eyes down over your nose. All right. Anything else? Yes?
Yeah, I just have a quick question, and probably nobody will ever know the answer, but I had a friend that had a stroke.
Yes.
And the day before, he'd had like a massage.
Mm-hmm.
And I've had it before, and sometimes when they do the neck thing, you know, they turn it and do different things, whatever.
Yeah.
I feel like someone never know what the answer is, and unfortunately I had a stroke the next day.
Yeah.
So every time when she does that or something, I kind of cringe
Mm-hmm.
because it could turn something loose, couldn't it?
You have carotid sinuses on both sides, and that carotid
Yeah,
sinuses.
carotid arteries.
And what they'll do is those sinuses control your blood flow to your head. Okay? when your body's under stress or tension, that makes those cardiac sinuses kind of hold or vasoconstrict those arteries, so it has less blood up to your head. The problem is to release them too quickly. Now that they vasodilate, now they open up those channels, those canals, those arteries, and now push blood to your head, changing that pressure change. Okay, so that pressure change from your body to your head allows, sometimes you'll have a headache, sometimes you'll feel nauseous for a short period of time until that equals itself out. A stroke, it's kind of hard to do, hard to predict for one too,
Yeah.
but there is possibility. You want to make sure if someone has those issues, you want to take an x-ray or ultrasound is probably even better to make sure the arteries are not calcified. When the artery or sinus gets calcified, they lose their elasticity. So the movement side to side or even pressure on those carotid sinuses allows them to become more brittle and become tear. At that point, it's easier for them to tear. So you want to make sure if you have problems like that, or you think you might, check with your doctor, do an ultrasound of your neck arteries, your carotid sinuses, and also your carotid arteries to make sure there's nothing calcified in that area. All right.
But a normal massage, well, like I said, nobody will ever know.
It's hard because
It's a coincidence, but
a stroke is a spontaneous event. So you can't say yes or no, but if you know, because I have a lady, Dolores. She is, how old is she now? I want to say 90, no, I'm saying 87, 88. She had one done, and now she has the other one done about a month ago, so I don't even touch her neck. Because she knew she had problems with her arteries before. So you have to kind of know your history. And a massage, like chiropractic, you have to be able to know your physical. You have to be able to know your own body's history. If you're unsure, go get checked. Don't waste any time. A stroke or heart attack happens because of other issues going on. Read your signs. I have people come to my office that have cardiac rhythm problems. If I tell them, have you seen a cardiologist? Yes. Great, I can treat you. If you haven't, go to your cardiologist first, and I can treat you based on knowing that the medical problem is not an issue. You want to make sure. Yeah. To answer your question? Kind of vaguely?
Basically. But you know if you're healthy, like they always say, I am.
I'm healthy.
You don't need to tell you have a problem.
Mm-hmm.
And you don't have tests done or they won't do them.
Yes.
Because you're a healthy person, you have no signs.
Yes.
Until I have my sign, and it could be too late. I mean, like heart problems run in our family, late 50s and 60s. My sister already had her heart attack, or she was a smoker. But then they look, oh, you've never smoked, you're healthy. But all my other relatives just drop dead, So it's like, I mean, doctors won't do a lot of stuff because you don't have any signs. But sometimes the signs, you know what I mean?
You know what the trick of that is? The trick with your doctor in your doctor's office is give them the right wording to do the right testing.
Well, yeah, I know what you mean. Or they can prescribe certain tests if they word it a certain way.
If you tell them I'm having headaches and being a woman, left or right arm pain, on and off with chest pain too, then they'll do an EKG. And I'm having problems where I have a lot of headaches only on the one side, then they'll do a carotid sinus ultrasound. You have to give them the right, if you don't give them the right wording, they can't put in their soap notes, the insurance company approves that test. That's the feedback loop. You gotta play the game.
Oh yeah, I understand. And unfortunately, now with computers, like before they used to open up a book and more history was there. Now it's one screen.
That's all it is.
And unfortunately, a lot of them don't take the time and have the time to go back and really look at all your history.
You have to be a proactive patient to be an advocate for yourself, going, hey, here's my history. If you, and we just talked before too, and my other talks too. If your doctor will listen to you, get another doctor.
Oh yeah.
You have to find someone's going to go, here's my history. It's my first time seeing you. Do you have time to walk through all of it? Yes. If they say no, then let me come back when you have time. Doctors, if doctors listen to you, they can't diagnose your problem properly. They can't do the right testing, so you waste your time then. Without the right listening for the start off of the doctor, the understanding, you can't get the right diagnosis, can't get the right treatment. I don't care if it's a chiropractor, optometrist, cardiologist, whoever it might be. You have to find a doctor and listen to you with your problems, not just this pain, what's going on over here, because that affects your whole body. A stroke happens because things have been going on for a long time. What's someone's lifestyle? Are they diabetic? Have they had injuries in the past? Have they had neck injuries in the past? So you look at the big picture, not just where the problem might be. Alright? That's my soapbox.
And I know it's always a time issue too, because if I ask 2 questions, it's one too many.
Then you find a different doctor who will actually listen to you.
10, 15 minutes or whatever.
No, that's not right.
No,
it's average. People put up with it, but they should not put up with it.
No, but
and you complain to the insurance company, you complain to someone upstairs going, I need to find doctors to listen to this doctor, because that doctor is a liability to the main company because they're not listening to the patients. That's a company issue where now they get sued. So the people upstairs are going to go, we don't get sued, let's take care of that patient. Not because of your health, because of being sued.
Oh, yeah.
So it helps them by knowing that that doctor is efficient. They're higher risk for that company. Maybe Kaiser, Blue Cross, Blue Shield, whoever it is. All right? Yeah, push. It's your
Oh,
health.
I understand.
You know? That's what I do. I tell them, hey, I want this test done. They go, why? Because I tell them, what's that required? I Google it. Because I have this, this, and this. Because
Yeah.
Google says I have
You
this
give
and
them
this
the
for that
symptoms, and
test.
then they have to do something.
Yes.
They have a liability problem.
Play the game.
Yes.
Well, I'm just.
That makes sense.
What he's saying is, I spent like 50 years, 7 hours a day, 5 days a week, over a computer.
Yeah.
Weird posture, because you have your
Yeah.
two hand like this. I've been retired now for a dozen years, and it's still taking an effort to pay attention.
Well, it takes work and effort,
still
right?
watching TV, I have to be careful.
That's why I come every month so I can harass him every time he comes in. Okay, but that thing is, can you be diligent with your workouts, with your routine? Part of this talk is, like you mentioned, doing them twice a day. Walking 15 minutes a day where you feel that posture coming backwards, negate the sitting in a chair all day.
I do turn commercials, I have lots of exercise.
Whatever works for you, but can you get enough time with your environment, your lifestyle, your routine, 7 days a week to do enough to counter that balance? Your body stays here. Stay here. What happens when you go here too? Your breathing decreases. If your resting breathing decreases, does it affect your heart? Does it affect your brain? Does it affect your muscles? Yes. When we keep our body up here, our lungs have a better resting capacity. At that point, your body can actually stay healthier overall. All right? Routine, routine, routine. Whatever it may be, 5 sets, 5 times, whatever it is, or even 10 times. Whatever works for you, find out whatever it is, water bottles or something else. You keep them somewhere so you can see them. I got to do those exercises. They're in front of you every day. I have a roller. I use my roller every morning. Keep it right by the couch so that as the dog waits for me, get my exercise done so I can take her for a walk. She knows. I keep the door open when she can go outside if she wants, but she knows unless I'm ready, she's not going anywhere. All right. Anything else? All right. If you want, like I said, if you want one of those papers up here, I can email you if you don't have my email list ready. I have a big list ready of seniors from this group that I send. In about 2 days, I'll send out once I load to YouTube, the link to YouTube to get the video again to watch these again too. All right. Have a good day. Yes. Thank you for the golf clap. Appreciate it. This talk helps you that you can get your neck and shoulders better, more relaxed, less painful, and less stress. You can handle more stress over time and make your body stay relaxed and even sleep better too. All right, so again, we have to stretch, we have to move, we have to watch overall posture over time. And as you do it consciously, over time it will become unconscious part of your normal posture, normal routine of stretching and icing every day. All right, so I hope you enjoyed this talk. In the show notes has links to our podcast, links to overall show notes, and links to overall Facebook page too. Leave comments there if you want to. If not, have a great weekend, great week, and have a good 2020. Talk to you next week, my friends. Have a good day.